All right, let's jump right in. Picture this. You're in a hectic emergency room. A patient shows up with this really confusing mix of symptoms, and you know the clock is ticking. Today, we're going to solve a clinical mystery by learning about a tool that just cuts right through all that chaos.
So here's the scenario. You've got a patient with pretty bad diarrhea, a super slow heart rate, that's what we call bradycardia, and their pupils are like pinpoints, which is meiosis. Now, your first gut reaction might be an opioid overdose, right? But is it? Getting this right is one of those high-stakes calls that clinicians have to make every single day.
So, before we can even guess at an answer, we need a way to think about it, a framework. And there's really just one core idea that's going to unlock this whole diagnosis and turn what looks like a jumble of symptoms into a crystal clear picture.
And that idea is the toxidrome. Think of a toxidrome as a clinical fingerprint left behind by a poison. It's a very specific group of signs and symptoms. And the real beauty of this is that it lets us group a whole bunch of different nasty substances, things like pesticides or even nerve agents, all under one single umbrella. And that makes figuring things out way, way faster.
Okay, so now that we have our new diagnostic tool, let's go back to our patient. Diarrhea, that slow heart rate, those pinpoint pupils. Keeping the idea of a toxidrome in mind, what do you think? What's the diagnosis?
The answer is cholinergic toxicity. But why? What's actually happening in the body to cause all this? Well, it all comes down to the parasympathetic nervous system. That's the body's rest and digest system getting totally overstimulated. It's just gone into absolute overdrive. And here's the nuts and bolts of how it happens. These things called cholinergic agents, the poisons in our case, they work by knocking out an enzyme called acetylcholinesterase. Now you can think of this enzyme as the cleanup crew for a chemical messenger called acetylcholine. So when the cleanup crew is gone, acetylcholine just floods the system, completely overwhelming it and sending all those rest and digest functions haywire.
Okay, so that's the science behind it. But let's be real. In an actual emergency, you don't have time to be flipping through a textbook. You need a fast, reliable trick to remember this very specific pattern of symptoms. So, how do you do it?
You use this brilliant little tool, the DUMBELS mnemonic. It's almost impossible to forget. So D is for defecation, U is for urination, M is for meiosis, there's our pinpoint pupils. B is actually a 2-for-1, bradycardia, the slow heart, and bronchorrhea, which just means excess fluid in the lungs. E is for emesis, or vomiting. L is for lacrimation, which is tearing. And S is for salivation. Basically, just think of it like all the body's faucets are turned on full blast.
So we're feeling pretty confident about our main suspect. But a good diagnostician always double-checks by ruling out other possibilities. So let's look at how comparing toxidromes makes our case even stronger and helps us eliminate the other culprits from the lineup. This chart really lays it out for us. Take a look at the opioid toxidrome. Now this is where it can get confusing, because it also has constricted pupils and a slow heart rate. But the big differentiator is usually respiratory depression. Then you've got sympatholytics, which also slow the heart. But there you're also looking for things like low blood pressure and low blood sugar. And amphetamines? They're the complete opposite. Fast heart rate and huge dilated pupils.
So you see, while some of the symptoms might overlap, the full picture tells the real story. Our patient didn't have that classic respiratory depression you see in an opioid overdose. They didn't have the other signs of sympatholytic toxicity, and they definitely weren't in that hyper-stimulated state you see with amphetamines. Only the cholinergic toxidrome, the one captured by DUMBELS, fits every single piece of the puzzle.
And that's really the power of this. This whole complex, confusing diagnostic process can be completely cracked open with just one simple, powerful mnemonic.
So why does memorizing this one pattern matter so much? What is the big takeaway from all of this?
It's actually pretty simple. Speed saves lives. Being able to spot that DUMBELS pattern in a flash doesn't just give you a diagnosis, it points you directly to the right antidote, to the right treatment, and gives you a real shot at reversing the poison's effects before it's too late.
And that's really what I want to leave you with. In the middle of that hectic, chaotic clinical setting, with alarms ringing and pressure through the roof, just think about how something as simple as one word, DUMBELS, can bring clarity, guide your actions, and in the end, completely change a patient's outcome.